Hello students, welcome to Science and Tech series with Dr. Vivek Rana. Hope all of you are doing well and your GS preparation is on right track. Topic for today's discussion is from health and medicine section. So there is a transplant which is in news. We will be decoding the term xenotransplantation, or you could say xenografting, in context of health sciences. To understand that topic and significance of that discovery, we'll have to first go into basics of how are different organs transplanted and what are the four basic means by which such mode can be executed. So this topic was in news last year as well. So this year there is once again a success story in which we have seen a successful kidney transplant taking from two different unrelated species, and the patient is doing well for almost now 1 month. So before going to xenotransplantation, let's just decode what are the four basic themes. The first and foremost transplantation or grafting, which carries the highest success rate, is the autograft. So we can say when a person who has suffered a burn injury or some accident, a part of which has been damaged, then the best kind of transplant is when you take a tissue from his own body and transplant it to some other site. For example, you have taken it from a thigh and you have just implanted on some, you could say the part which is visible on a neck, or you could say the any limb region. So such transplants are called autograft. Such transplant do not carry major risk and they have high success ratio because there is no risk of matching the blood grouping, or there will be no immunological, you could say, rejection of the structure. So this is the first and foremost priority whenever aesthetics, or we could say the reaction becomes the criteria for a transplant. But in a lot of cases this may not be possible, especially in case of organs. So in that case we have to rely on other modes of grafting which will carry a little bit of risk, but with advanced medical sciences the transplantations have are becoming more and more possible. There is another transplant which carries high success rate, but it has its own limitation. The second type of transplant is isograft. In isograft, the when tissue or any organ are being transplanted between two identical twins, then the term isograft is preferred, because an identical twin have more or less similar morphological traits, so there is hardly any risk of rejection, and this transplant has once again has a high success ratio. But then there are the selected example of identical or Siamese twins born in a large population. So this method is only available in case of the twin individuals. Now, the transplant which you often come across in medical hospitals, especially when there is an accident, and we come across articles like a young person died in an accident and he in a process saved two or three individuals life, or so that type of transport in which two human beings are involved of same species, then transplant is given the term allograft. So here the topic of blood matching and immunological reaction will come into picture. Lot of time we have seen that even though this transplant is carried out, the person may not survive for long due to immunological reaction or some other medical complication developing sooner or later in the individual. But nevertheless, this is a life-saving intervention. We have seen in structures like kidney, a lot of individuals, often close relatives, comes into the picture and they donate one of their structures to, which can be a life saving. Otherwise, the person has to rely on dialysis and other basic methods. So basically, in this method, the basic protocols of blood matching are of paramount importance, and in a lot of cases when we have do not have a close relative available, then even some other distant person also comes into the picture, because saving the life of patient is of paramount importance in medical ethics, and this is a totally acceptable means if you have followed proper legal document. At times, this method becomes controversial. We have seen some private hospital at times using not using the right means of consent and using economic bait from poor patients to donate their structures to save a rich life. In that case, at times allograft becomes controversial as well. But in medical terms, this is the quite acceptable means of saving someone's life, especially when there is a clinical biological death picture comes into a picture in case of an accidental patient. Now the topic, let's come to the topic which we are taking from current affairs perspective. I hope now the basics of grafting are clear. Now the most controversial and ambitious, you could say, the grafting which carries the lowest success rate is the xenograft. Now, the xenograft or xenotransplantation is the uncharted territory. Here, we bypass the species barrier. In simple terms, we can say when a pig, horse, dog, or a cattle structure is used to save some human life, then such, you could say, there is the difficult in matching the immunological basics and carries high risk of, you could say, fatality as well. So such domain, when you are transplanting organ tissue or any structure between two different species, two different biological species, then that transplantation is commonly referred as xenografting or xenotransplantation. So the question comes into the mind, has it ever been tried? Yes, it has been tried multiple times with limited success. Last year we had seen a bold experiment where in US where a heart was transplanted from a genetically engineered pig. Make sure it's not that you will just pick any random pig and try to transplant in human beings. First, the pigs are genetically engineered. They are raised because immunological risk is very high. We cannot just mix and match any two distant species. So after genetic engineering has been carried out, so there is minimal risk of immunological reaction, then the structures are implanted. So in that case, the person survived for almost 1 month, and he was a convicted person, and he has no we were dealing from a medical complication where the chances of survival were less. So he went ahead with it. So now in this week, once again, the picture which the news has come from US, the New York, you could say, physicians have carried out a bold transplant in a person who was once again neurological dead. So he was on life support only. So he needed a kidney, so they used a pig and used its kidney to be implanted into that person. So it has been almost 32 days, and the kidney is functioning quite well. So and all other physiological parameters are also normal. So this is counted as the new success story, because every year in a developed country like US also, every day 17 patients die on want of organ transplantation. In India and other developing countries, the picture becomes more grim. So we can say that such transplantation are going to be a frequent norm in coming decade, and it is quite, even though it's ethically contentious because you are sacrificing that animal in the process, but in case of human life being saved, it is at times being accepted, because we had seen the controversial domain of cloning being also acceptable on similar parameters, that once you have prepared a genetically engineered animal, it can be cloned in multiple copies, so that eventually if you have to do an organ transplant, it becomes ethically acceptable. So, say in that context, this technology carries its own risks and benefits, but overall, it's a bold new paradigm of organ transplantation, which at times can help in curbing the shortage of vital organs. Because we have seen in kidneys, there is still a loop in which lot of individuals at times sacrifice one of their kidneys to save a close relative. But in case of vital organs, especially in case of heart and other neurological structures, there is a lot of scope for such bold experiments to be carried out on frequent basis. And if they are you could say, if they work for more than 6 months, there is no harm in carrying out such controversial experiment. So I hope the basics of transplantation and grafting are clear. Make sure you just keep a revision of the blood grouping topic, because sometimes, and there is also topic in NCRT which deals with the organ transplantation, which organs have high success rate, which have a narrow one. So make sure that comparison is also clear. So once again, to summarize, when a transplant is between same individual from one part to another, it will be called as autograft. When transplantation is between two identical or Siamese twins, the term preferable would be isograft. When the transplant is between two individuals of same species, then the term is called allograft. And when the transplantation is taking place between one individual from one species and another from different biological species, only then the term xenotransplantation or xenograft is used. I hope we have now clear with the basic but different types of grafting being available in biological sciences today. If you have any specific doubt or that comes into your mind regarding this specific topic, feel free to ask in comment section. We will revert with some genuine queries and answers. So I hope you are following the series Science and Tech and other being uploaded on CCS Academy. Have a nice day. Thank you very much.